Managing the side effects of cancer treatment is very important to helping you feel as well as you can and avoid interruptions to your treatment plan. Let's talk about how you can eat to fight the side effects of cancer treatment. If you can't swallow your usual foods, try changing the food texture to softer foods. For breakfast, instead of toast and bacon, try cooked cereals, pancakes, waffles, soft scrambled eggs, or cold cereal softened with milk. Replace fried meat or tougher beef roast with moist chicken, meat salads, soups, stews with ground meats and diced vegetables, cooked fish, tender meatloaf, or non-meat protein sources like tofu and beans. Instead of French fries and tough stir-fried vegetables, choose foods soft in your mouth like macaroni and cheese, rice, cottage cheese, and mashed vegetables like mashed cauliflower or potatoes. In place of cookies or nut pies, try desserts with creamy textures like pudding, ice cream, or milkshakes. Try soft textured snacks like banana, applesauce, canned fruit, gelatin, smoothies, yogurt, and creamy nut butters, or cookies dipped to soften in beverages like milk. Changing food texture can be easy. Try this herbed Spanish omelet. The recipe is on mypropoint.org. You may want to modify your meal style. Go for 5 to 6 smaller meals instead of 3 larger ones. It may be easier to eat a smaller amount of food at one time. Cook foods until soft and tender. Chop or puree foods in a blender or food processor. Moisten and soften food with gravy, sauces, broth, or yogurt. Drink beverages with meals. Keep your mouth moist. Alternate sips with a bite of food. Sip drinks through a straw if this makes it easier to swallow. Boost your nutrition. If you can't eat enough at meals or snacks, drink a nutritional beverage, smoothie, or milkshake. If you have trouble swallowing thin liquids like water or juice, try buttermilk, eggnog, or yogurt shakes. Or use a commercial thickener in your drinks. Your speech therapist can teach you how much to thicken your beverages. Also, avoid alcoholic beverages. See our video, Eat to Fight Sore Mouth, to get more suggestions for fluids. Difficulty swallowing can be a safety risk. Swallowing trouble can trigger food getting stuck in your throat and aspiration of food into your lungs. You and your family can learn the anti-choking procedure for emergency rescue if you have food lodged in your throat. Your healthcare team may refer you to a speech therapist who can help you learn tips to swallow effectively and to be safely nourished. The therapist will evaluate your swallowing and eating and then work with you to use the safest food texture and thickness of beverages. Call your healthcare team immediately if you have swallow issues while eating or if you have a fever, a sign of aspiration. You will find that some foods and liquids are hard to swallow or are very irritating to your mouth or throat. If you avoid these, you will increase your enjoyment of meals and be well nourished. Some irritating items to avoid include coarse foods that don't soften in your mouth, sharp and crunchy foods like potato and tortilla chips, spicy foods such as pizza, fried foods, and burritos, high acidic foods like citrus and tomato products, alcoholic beverages. Hot foods may burn your mouth. Try room temperature or cold foods. Remember to be patient with yourself, as side effects of treatment are usually temporary. Overall, just try to make good nutrition a priority, knowing that you can eat to fight cancer side effects. Thank you from PearlPoint. Visit MyPearlPoint and set up your profile to get nutrition tips and more. It's quick, easy, and free. Our side effects management app is also available from MyPearlPoint, so you can have our suggestions on the go.